everyone, to another episode of Recharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi, joined by my co-host, Mandi, Dickey. We are on AM 950 Radio, and as usual, we're going to talk about, what affects you, how you can become the CEO of your own health. And there's so many topics we can discuss, but I thought today would be a great time to talk about the obesity crisis in America. And this is a very touchy subject for a lot of people. And I could tell you my own colleagues are personally struggling with how to handle their patients. We all know that things are getting worse. If you look at almost, every state in the country, things are getting worse. If you look at the shift in obesity in the adult and the pediatric population, it's pretty wild to think about it. And for some reason, we have normalized it. So just to give you an idea of what's going on, by 2050, 64% of the population is projected to have obesity. 64%, right? It's about half of people now, and it depends how you do it. And a lot of my patients are frankly morbidly obese, which means their BMI, depending on how you define it, is greater than 40 or 35. And again, there's some controversy in exactly, what's really out of control, but it's out of control. Okay. And so in 2023, 23 states had obesity rates already of 35% or higher. And we're not talking about overweight. We're meaning like frank obesity. It's reaching, 20% plus levels in kids, 34% or so in adolescents. And then you're in the 50s and up by the 2050 range when it comes to the rest of the population. Now, the reason I say it's a touchy subject, because as healthcare providers, we see what we see. But then there's a lot of discomfort in really talking to patients about it, especially when you're not an obesity doctor, because you don't want to get bad scores. You don't want them to say, oh my God, this doctor, is being mean to me. This nurse practitioner is being mean to me. So people literally skirt the subject. So they have people sitting in front of them that are 150 pounds overweight, and there's not even a discussion of their obesity. So I ask them often in clinic, well, what's your plan here? And they don't have one. And that bothers me beyond what I could even describe here. And this is a PG show, so we'll keep it PG, but I don't want to stay PG. But anyway, how do you approach, how do you broach the subject? You just say, hey, we got a problem.
And I guess being in, as a stroke provider that I was for several years, weight was always a risk factor. So we had to address it. It was not something that I was able to skirt around. So it was always a conversation that we had to have. It was all in how you have the conversation. So I've heard stories about different providers that have had very difficult, very rough conversations with their patients. And then you can have very respectful conversations with your patients. And I think that's where we need to have the magic happen, is having those respectful conversations, because you can do it without making your patients feel like crud when they come in there.
No, absolutely. I mean, I think that is a critical saying, and I'll just save it for the other side of the break. I'll just tell you, some of the stuff that I've heard from other providers in broaching the subject before we dive into really what do people need to do, to stem the crisis. But it's really interesting. You're absolutely right. Everything we do starts with respect, starts with them understanding the reason we're broaching this is not because it's not a judgment thing. I mean, you're coming in and you're coming in to feel better or to get better. And so what am I going to talk to you about? Like the weather? If you're more, we have to be able to have these conversations, frank conversations about everything. And that is really going away in medicine. And everyone's in a big rush to get them out of there. Just write them a script. And sometimes it's even writing them a script for obesity. And we'll talk about that a little bit later and what the dangers are of just giving people scripts and just saying, well, do this and you'll be fine. You need a comprehensive program. But anyway, we'll see you on the other side of the break. We're on AM 950 Radio. This is Recharging the Human Battery. See you soon. we are joined by Mandi Dickey, our nurse practitioner, and my co-host. And we're talking obesity crisis because we have to. And again, on the other side, when we started, we talked about how difficult some of these conversations are, but we have to have these conversations. And frankly, if you think radio or you think shows, it's not like you turn on the radio and people are talking about the obesity crisis, but yet it's right in front of us. So I'm going to be a little bit, I'm just like, we have to just say the way it is. So a lot of times people are trying to make a statement when they're making movies and things like that and looking at the future and things like that, right? So, right, we think about like things like 1984 right now. Everyone's like, oh, 1984 is coming true, all this stuff. But I think that, again, I'm not saying any of this to offend people. As you know, both myself and we just love people. We just want people to be better. I don't care if you're 500 pounds or you have anorexia, and that's a whole other issue we could do a show on. But the bottom line is, if we're not honest with you and you're not honest with yourself, you really cannot make the changes that are gonna be impactful in your life. So before we get into kind of how we handle it, I just want to talk about a movie that it's really important. And for those of you who haven't seen it, you should see it. And again, I'm not trying to point, I'm not pointing fingers. I'm not doing anything. And I always say this because I know that those of you that have obesity, especially if you're morbidly obese, are extremely, it's something that is very bothersome to you. Sometimes you don't even want to think about it yourself. Sometimes you're so far down the rabbit hole of having food addictions and these other things that you know that you need to make a change, but you're so depressed about not being able to make a change that then you binge even more, and it's this vicious cycle. So the movie is WALL-E. And I don't know if you've seen the movie WALL-E, but it's a future, and they make a lot of comments. So on the one hand, basically we've ruined the earth, and the earth is like this barren wasteland, and there's this robot WALL-E, and he's cleaning up everything, and of course humans have destroyed everything. That's a whole environmental discussion. That's a whole different thing. And there's a lot of politics that goes on this radio show, so I'll let the politicians deal with all that stuff. But the interesting thing is, so these people have been out there for hundreds or thousands of years. I forget exactly what it is, and they're out on the spaceship. And the crazy thing is that the humans have become so obese that they literally cannot get out of their chairs. And so they're in these in these lifts, like when you go skiing, and they just like spin around the spaceship, and their clothes like change automatically. So they're sold all these products. There's so much great stuff in there that goes with what we're talking about. So there's all this fast food stuff and whatever. There's one scene, it's funny because they're in the lifts, and they're being sold products. And they're like, oh, red is the new blue. And they're like, ooh. And they all like change their clothes instantly, because this is where we've gone. Like, it's such a consumerist society. But the truth is, eventually there's like a rebellion on the ship and everything. And they have to get out, and literally they have to learn to walk again, because they can hardly walk. And the thing about it is, I understand that it's a movie, but I'm telling you, from what I've seen, we literally are going in that direction right now, and it is catastrophic. And again, if you haven't watched that movie, watch that movie. Again, I'm not singling out anyone. I'm not doing anything. We want to help. If another thing I would ask you to do, like as far as obesity, watch Jillian Michaels. Okay, you know her. She's famous for all the weight loss stuff that she does. But watch her testimony to Congress when she went on there. I mean, literally like teary-eyed, just going crazy about how much our society has been brainwashed, and why we're just in a crisis right now. And whoever thinks we're not in a crisis, if your doctor doesn't think we're in an obesity crisis, go somewhere else, because they're wrong. It's horrible. Why do we even care about obesity? If people were, quote unquote, healthy fat, again, I don't even like to use that word, because then people, then comments and all this other stuff. But like if people were healthy fat, which it's a very tiny percentage, I wouldn't care. It's just like if people could eat value meals all day and they're great, you know, all their biomarkers are fantastic. Their blood pressure's fine. They don't have cardiovascular disease. They're not dropping dead of heart attacks, young, getting Alzheimer's disease, all this. Oh, who cares? We wouldn't even have this show. Nobody cares. We would say it and they're like, well, you just hate, you know, like you just hate value meals. Okay. The problem is that when you have obesity, your risk of diabetes, cardiovascular disease, you know, respiratory problems, hypertension, brain disorders is off the chain. It really is so dramatic. And so I have patients come in, and I'll pause for a second here. But how many patients, we've talked about this before, but how many patients that you have come in, I don't mean they're overweight. Okay, I get it. People go up and down in their weight and stuff, and we try to help them with that. But the people, I mean, morbidly obese, 150, 200 pounds overweight, inflamed, everything's swollen, their skin is terrible, all this other stuff. And again, I'm just telling you that because when we've seen patients for so many years, they just walk in, you're like, you are a bundle of non-health, right?
Yeah.
And I asked them, how's your health? And what do they say, Mandy?
I'm fine. Good. I'm great. Yeah, there's a lot of denial going on because they don't realize how unwell they are. And I can't tell you how many times people would come in, and I was working this stroke clinic or working in the hospital, and we'd have a patient come in and they would have a stroke, and we would check their A1C, and their A1C diabetic marker, it's diagnostic at 6.5. Theirs would be like 12 or 13. And they would say, well, I didn't know I had diabetes. Well, how are you eating? And I could tell you had diabetes, but you just didn't have it checked before, basically. But
that's called, not to interrupt you, but that's what we call like candy canes coming out of your blood vessel. So basically around Christmas time, these people that have A1Cs 13, 14, if you basically go to put an IV, there's little miniature candy canes coming into the
sugar crystals.
Just those sugar crystals. It's just literally sugar water, and it's devastating to the body. But go ahead. Sorry.
It's awful. That sugar beats up your blood vessels. It gets into your brain. 10 years ago, we were calling Alzheimer's diabetes type 3, and it just hasn't hit the mainstream yet. So the more you eat like that, it does affect your brain. It affects everything in your body. And people get into this downward spiral. So when, as you were talking about Wally, I was thinking about this. We get into this downward spiral. You get to the point where you start getting overweight, and then you start getting less active because it hurts your body to be active. And then as providers, we're trying to tell you need to be more active, but then you're being less active because it hurts. And then the less active you are, the more your weight goes up. And it's this downward spiral. And you get to the point where it's really difficult, and it's almost a point of no return. But there's a point in there when you can stop it. And there's a point in there when you have control. And once you lose that control, then that's where some of the other treatments that come into play that we'll talk about. But it's getting that to the point where we have that control and identifying with patients that they have that control and they can make changes
100%
in a respectful way when we have that conversation.
Absolutely. And what I will say to everybody listening to this show and those people that follow me, the only day to start on that journey is right now, today. It's not tomorrow. I have this conversation with my patients all the time. What are we going to get? Oh, I'm going to start. Thanksgiving is right around the corner. Let me get through that, and then I'll look at some of the changes. No, the only time to start today, the only time to go to the gym is today. The only time to catch up on your homework is today. And if you start having that mentality constantly, it's good. Now, the other thing about the stigma, and I want to get into the, some of the, pearls that we can give you. I mean, this have to be a 10-hour show to go to everything that is available, with weight loss. But on the stigma front, it's okay to say that you're not okay, and just kind of, people are there to support you. So if you are basically understanding where you are in the process and you look for help, right? Believe me, you should not have fear, because if you ask your provider, hey, what do I really need to do? I'm dedicated. I really want to do this. I can't even imagine somebody like pushing back and just saying, oh, you're too far gone. There's nothing you can do. No, they're actually going to get excited, say, wow, this patient wants to be my co-pilot in this is great. I actually have somebody who's motivated. So forget this, that you're putting stigma on yourself in some ways. The same thing we talk about with psychiatric disease. People want to help psychiatric disease. Like my patients, I know I'm a spine surgeon. I want them to talk to me about like, oh, I have severe, oh my God, you have depression, you're talking to me about it. Let's get you help. There's all these resources. And the other thing is about frustration. Some of you are going to try some of the things that we're going to talk about in a minute, and it's not going to work. There's so many things that you can do. So don't lose faith. Don't get it, that. And listen, it's easy for me to say. I mean, obviously people spiral into these horrible, dark places, but there is a lot of help available, whether it be non-medication options, medication options. There's a whole surgery. There's a whole host of other things. I have good friends that are bariatric surgeons. We're going to touch on that just a little bit today. Again, we need a 10-hour show to talk obesity medicine. I can't get it all in, but let's hit the major points. That was kind of the mentality behind maybe what's stopping people and kind of, what's out there. And then at the end, I'll just talk about like my kind of what I tell patients and how I kind of break the ice and get into that conversation. And they're fine with it. They're fine. I'm not joking. I've never, because of the way I approach it, and it just whatever. And I'm very casual. You know my style. I've never had a patient get upset with me when I talk. Never. But yet I have they're like, oh my God, this patient yelled at me and all this stuff. And I was like, well, obviously you came off in an extremely disrespectful way, because people want help, right? If
it's all in the approach.
You can definitely offend people. So what are the big, let's just talk about the big ones. Let's spend a little bit of time. Obviously the big one is what's on your fork, right? Your dietary changes. That's the big one. So there's a lot of different ways to skin this, but you have to do something. I have heard, and not many times, and this actually bothers me. So, people go and ask, sometimes they ask for help, but there's no time or whatever. And they see certain people and they just say, well, what should I do? They're like, well, instead of a full sandwich, have a half a sandwich. I mean, wow, that's really profound. Thank you, for that amazing advice, but not talking to them about, their macronutrients and all this other stuff. So that's not great advice, obviously, but I'll tell you this, there's many, many ways to skin this cat. And there are these purists out here that start jumping up and down. You got to do this diet. You have to do this diet. You have to do this diet. And we've touched on that before, but I can tell you, for both obesity management and management of diabetes and insulin resistance and everything that comes with it, including, cognitive decline and hypertension, all these other things, whether you go down the vegan route, okay, whether you go down the carnivore route, and again, people get pretty, but and whether you go down the intermittent fasting route, mixing in those other things, or those other Mediterranean diet, flexitarian diet, pescatarian diet, there's so many different diets. And I've had amazing people on my podcast. I had Dr. Katz, who sits on the U.S. News and World Report. He's one of the judges for these diets. And so one of the things that I will say in that is every diet I just mentioned is so dramatically better than anything that that the average American is eating now. We touched on that, last week in our show, but all of these are going to be effective in some way. It's very simple. The sugar we talked about is a disaster. It's an absolute disaster. 130 pounds of sugar a year, refined sugar, Americans. I can't even talk about how devastating that is to your body. Processed foods, we've gone over and over, but whole foods, mostly plants, unless you're on the carnivore diet. That's a little bit different. Healthy proteins, fats through nuts and seeds and things like that. That's what it's all about. And just getting on one of these diets, either through a dietitian, through your own research, through talking to your doctor, is going to, literally change. A lot of these diets can reverse type 2 diabetes. I don't say that lightly. And when I say reverse, I mean normalize it, period, without medications. Again, this is not medical advice. Me and Mandi are not here. We're not giving you a prescription or telling you what to do, but we're just telling you this is the facts. This is data. You can look it up. You don't have to take my word for it. There, Google it, do whatever, but I'm telling you the research is out there. And then okay, so that's the diet piece. Again, we could do a whole other show on diet, a whole thing. Physical activity, you got to find stuff that you like. So whether it's doing walks in nature, getting to the gym, resistance exercise is wonderful because it's going to build bones, it's going to increase your muscle mass, and especially if you're on any weight loss drugs, you've got to do the resistance exercises because and we'll touch on that. I want to spend kind of more time on that than anything else because that's the questions. If that's what people are asking right now. But at least the general recommendations like 150 minutes of moderate activity. So if you like, obviously, I mean, my preferred is like high intensity interval training because you get such bang for your buck. It's incredible. But some people can't do that because you're right. They have the mobility issue. If somebody's 400 pounds, hit exercise, that is a little bit of a long shot. So maybe just walks in the park every day, a half a mile or a mile, or just getting exercise. The bottom line is if you don't enjoy it, you're not going to do it. And so we've got to really think of creative ways, to get you, out there exercising. And it's really a behavioral mindset change. And it really has to start now. Okay. It's got to start now. I don't know how to say this more. Maybe you have a better way to say it more clearly. It's like now, it's critical.
No, there isn't a better way to say it. Like I used to be a fitness and a fitness coach, and we always had workouts that started on Monday. The calendars always started on a Monday. So people would wait and they would start their things on a Monday. And I started getting to the point where I'd be like, don't wait until Monday, just start today. Because if you wait until Monday, something else is going to come up and Monday's going to come and you're going to miss that workout. And then you're going to say, well, I got to wait until next Monday to start now. Just don't wait, just start.
I mean, that's great. I mean, that's great. I don't, I don't know how else to say it, but you've just got to do it. You just have to think to yourself, where am I in life? Is this what I want? And I really want you to understand, if the longer you stay in an obese state, especially those of you that are 100, 150, 200 pounds overweight, the more you are damaging every organ system in your body, including like especially your microvasculature, which is kind of so you're damaging your kidneys, you're damaging every vessel in your body. And guess what the brain is filled of? A lot of vessels. Look up like vasculature, look up in Google, like look at the vasculature of the brain minus the brain tissue. I mean, it's crazy. And you're destroying all those things, and those are feeding your neurons, and there goes them. And then people are like, "Oh I'm having cognitive decline." Well, I'm shocked. You have insulin resistance. You've got plaque up in your arteries are hardened. I'll use lay terms, and we have to get away from this. Cholesterol is the evil. It's the sugar that's the evil. And we could talk about cholesterol an entire show about the misinformation on what cholesterol causes versus what sugar causes. I will tell you, sugar and processed foods, there's your evil. We got to get that out of the system. So now I know what you're all thinking. I don't want to talk about this stuff anymore. I want to talk about obesity medicines because I cannot put anything on the radio anymore where I'm not being bombarded. Who is not dishing out these obesity drugs right now? Like, I don't know, pretty soon you go to the barbershop, you get your obesity drugs, you go to Target, it'll just be like there'll be some guy like some person shilling it to you. So let's talk about what they're based on. The ones that you hear about the most are called GLP-1s, right? Glucagon like proteins, and they mimic something in the body. Well, I'm not going to get into a lot of detail today because, again, we'd be here all day. But the bottom line is that they can normalize your blood sugars. They can create a lot of weight loss. I mean, significant amounts of weight loss. I'm talking about like, a teens percentage of body, weight loss, which is really, really good. But they come with side effects as well. And so that's the issues. And so just talking about it. So semaglutide is another, way to do it. It showed really impressive results. So if you look at some of the studies after these injections that you can take after about, 4 or 5 months, people were showing like more than 10% loss of body weight. There's other ones that after 8-9 months were showing 20% loss of body weight. That's pretty dramatic. And we can all tell stories, like me, not even as a physician or people I've been involved with medically, but people that I know that have gone on these things. And then you see them and they're like, look, they're totally, I'm like, who is that? Who is that person? Okay. So that seems great. And I could tell you from an economic standpoint, when these things were rolled out, there was mass panic in the food industry. And oh my God, we're not going to be able to sell our, our bun cakes and whatever they're selling. Everyone's panicking. They're like, oh my God, this is a panacea. This is going to change the world, whatever. I would like to know, like, which drug that we've ever promoted like crazy people has ended up as good as a thing. Like, shall we talk about fen for weight loss? That didn't end up too good while people were dropping dead. So all I'm saying is that I am certainly pro these drugs for certain cases, for sure. And it's a game changer. It is. And some people are so far, we do need different things. But on the flip side, giving any drug out like candy, so like pretty much like the statins, another show, we could literally do an entire show on statins for cholesterol and why it's so bad in some ways. And I'm not telling you to stop your statins. That's between you and your doctor. I am just telling you that the stuff we could talk about will absolutely blow your mind on statins. Let's talk about GLP-1s though. So there's a lot, but there are issues. So number one, it's crazy. So some of the studies show that over 50% of people, they don't even finish enough of the medication to be able to do it because they have so many side effects. And so you've got gastric emptying problems. So it works. There are receptors in the gastrointestinal system that take these on. And so they slow down your motility. So when you take them, of course, you're not hungry because nothing's moving. And so so I will tell you, when you guys, and everybody knows this feeling, when you eat kind of the wrong thing and about 3 or 4 hours later, all of a sudden, you're not feeling that well. That nausea and whatever, that is because your gastric motility and your whole GI tract is slowing. And if it slows enough, you know what happens? You start vomiting. And that is exactly what can happen with the GLP-1. So some of the initial things is, you feel a little bit nauseous. Now, if you start with very small doses, you can really mitigate some of these things. But I can tell you, 30% of people stop taking these things in the first month because they can't even tolerate the side effects. Now, a lot of it is because they're just being dished out prescriptions without getting all the other things on the side, because there's peptide stuff you can bring behind it. There's all kinds of stuff you can do to mitigate the symptoms. And interestingly enough, a lot of these symptoms, a lot of the biohacking we always talk about can actually mitigate the symptoms of taking the GLP-1. So it really has to be a comprehensive strategy. And that's what we're focusing on, because we do some of that at Hypercharge Health, but it comes with an entire program, not like you see the provider, you get a script and we'll see in 3 months, call me if, you have a bad complication. No, you got to do all these other things. So that's one thing. Then the other two biggies with managing, the big one is the amount of muscle mass that you can lose on these things. I cannot stress enough how devastating that can be. So if you take people that already have muscle mass issues, and a lot of these, and they haven't moved, so they already have muscle mass loss, and now you're gonna take away another, because up to 40% plus can be lost muscle, not the fat. So if you lose 30 pounds, do the math. 40% of that is muscle. That ain't good, right? And then you can lose the muscle in your face, otherwise known as Ozempic face. I'm not picking on Ozempic. I'm sorry. I hope I don't get a letter from, the Ozempic people, but it's a well-known term. I didn't make this up just now. You could get the same thing on your buttocks. We're just going to keep this, again, PG, like I said before. And you can have some people look like skeletons after taking this. They went from being very puffy to literally they look like a specimen you would see when you're looking at like a skull. It's pretty wild. And so these are things that need to be taken into account when you're taking these drugs, but blocking the loss of muscle mass is huge. And so how are we doing this in our clinics? There are certain you can block the enzyme that actually breaks down. It's a myostatin blocker. It blocks the enzyme that can break down muscle, which is great. So we put our patients on that. And then you can do all kinds of other things. Number one, protein, right? Per kilogram, where instead when people recommend 0.8, whatever, I would recommend more like 1.2, and we can go from there. But also the other big one that's interesting about a comprehensive program is that there are things like these devices like the mSculpt Neo, which is a combination of a high stimulation. You can stimulate the muscles and at the same time do radio frequency on them. So it heats the tissue, and then you hyper stimulate their muscle, and it could rebuild their muscle while they're doing it, so we can prevent loss of muscle while they are going through their program, and hopefully we can get them off of these drugs. But there's the snapback, which is a whole other issue, but when done well, it's doing. But then there's also something called the M-Face Neo, which is the same thing for the face. You can build back the muscles of the face by utilizing the same technologies. I'm not hearing any of this stuff in the commercials. I ask my patients that are in the GLP-1s that are complaining to me about their side effects, and I'm like, okay, well, what's your program? Well, they don't have a program. They got a thing. Or even worse, they got it on, they got it through their hairstylist who knows the compounding, and they got it through that. So they're not even on a program. And so just like brain stuff, right? How important is it to like comprehensively treat these people like you from multiple different disciplines and take the best of all the worlds, the stuff we talk about constantly?
Yeah,
right.
You have to look at it as a whole approach. It reminds me of a research article that was done a few years ago about just reversing type 2 diabetes in general.
Yes.
And they did a comprehensive program for 6 months with diet, nutrition, exercise, and monitored these patients on a weekly basis for 6 months. It wasn't just, here you go, here's your plan, let's see you back in 6 months and see how you did. Because if you just let somebody go, you'd have no idea what they're going to do, if they're going to follow the program, if you give them any kind of program whatsoever to follow. But doing that kind of follow-up with them, you're going to get better results anyway, because you have that team approach. There's monitoring going on. So you have to, for any kind of program for success.
Absolutely. And so honestly, people think we talk about this, whatever, because we do all kinds of stuff. So, men will come in, and I'm talking about like the health stuff that I'm doing, not at my spine clinic, at our other clinic. Like men will come in and they'll want, and they do have low testosterone, and that's we can multiple episodes on that. Very complicated. There are so many different things on that, and that has to be done very judiciously, just like the GLP-1s. But the first conversation with them, or if you want to do a weight loss program, whatever. So for those people, for hormone management, the first thing I'm going to tell them is, you have to understand, managing your hormone, this is for life. So if you're going to go on TRT replacement, this isn't like you're doing this because you're going to do a bodybuilding competition. This is because obviously you have hypogonadism or whatever else is going on. We have to manage this for life, or your symptoms are going to come back. It's the same thing with obesity management. So at minimum, so patients will say, I want to do this. I'm just going to go on these drugs for 3 months and then I'm done. Zero. That's not a plan. So you need a long-term plan. So number one, you want to tell people you're going to be with us at least for a year doing this, or wherever you're going, whether it's your primary is managing it or whoever's managing it. These are long-term. We have to work together to get you where you want to be. But we also don't want you to snap back, because then you might go in a worse, worse depression and all this other stuff, and then, be more obese because you're depressed that everything wore off because you disappeared. Right. So we kind of need you in the mix. So this is a long-term commitment to yourself. You're not committing to us. You're committing to yourself. It's the same thing with in anything that we're doing. This is how you do it well. This notion, same thing with depression management or PTSD. It's like, you don't get a script and you disappear and you're great. I just take a script. I'm going to be great. And it doesn't. I'm sorry, it doesn't work that way. what in life, I mean, yes, you can find gold or strike oil in your backyard. Everyone, that stuff happens sometimes, and that's great, but that's 1 in a million, right? Most people have to, work at it. So back to, the comprehensive approach. If you are interested in the GLP-1s, and again, we can, talk about these are drugs that are everywhere. They can potentially make a significant impact if you're the right, person, but you have to commit to a comprehensive lifestyle intervention, making sure your muscle mass is preserved, making sure you're not having serious complications, being on top of if you're having serious gastric emptying issues, because you must stop them. If you do that, you can't keep pushing forward because there are already, issues going on, and people like having these things that don't get better because they're too far down the road. This is very important that whoever's managing your obesity, whoever's doing your obesity medicine, really understands the comprehensive nature of what you're doing. If you're going somewhere and they're just giving you drugs and really not monitoring you, or just like monitoring you with some survey, that is not the right thing. And again, I'm not trying to do this. This is not, trying to say, oh, these people, they're trying to help, but that's not a good way to help. I just did want to mention one other thing that we have to be careful with, and that's why you really need monitoring. One of the pleasure reward center in the brain. Okay. And I had Dr. Blum on my podcast, and he should have won the Nobel Prize. This guy's in his 80s. He has more energy than I could ever imagine having. A brilliant guy. I would ask you to watch the podcast with me with him. It's not easy to follow him because he's out there, but brilliant. He gets very, very deep in the weeds, and some stuff is hard to follow. But there is some concern, and we have to monitor this really carefully, how it's affecting your brain. And so we talked about the receptors for GLP-1s in the intestines. There's also receptors for GLP-1s, and they happen to be located in the pleasure reward center. So we've talked about this a lot, both on my podcast, Mandi talks about it. We talk about it on our show. When you give any single molecule type medication or single target medication, there's a lot of other cascading events. So that pleasure reward center is where basically serotonin is converted to dopamine. You're messing around in that area, you can have stuff. And so we have to be really careful with depression symptoms, suicidal ideation, all this other stuff. Even I listen to these commercials on the thing. No one's talking about the psychiatric potential effects. Now, most people don't get these things, but if you get them, when we're talking about suicidal ideation, that's not where we want to be. So we have to be really on top of these patients. And I will tell you, I did a post about 3 or 4 months ago. It was a little bit of a rant, and it was about this girl, and she's very smart. And she's like this hairstylist lady. And she's over there, and she's got this huge following, and she does all these recommendations for people that are on GLP-1. She talks to them, she tells them how to manage their symptoms and all this other stuff. And my take on that is not, I'm not going to say she should, whatever. You guys do what you want. You know how I feel about going to experts. But what I'm saying is, think about it. She's not, and in many cases, she's not dosing these things. The people that are dosing it, they're clearly not following up on their patients, who are then going to a hairstylist to figure out how to manage their symptoms. How bothersome is that to you? Or what is your say on that?
Honestly, I'm speechless. I don't even know how to respond to that. Like, how?
That's the right response.
Yeah.
I can't even comment right now. But again, it goes back to what is happening in medicine right now. The follow through, the follow ups, the thing, it's just not there because we're not. And again, a lot of it's the system. I'm not even putting it on the providers. They don't have time. These things take a massive amount of time. And so that's why, like me as a spine provider, I decided that I wanted to go down the wall. So, but not only do I want to go down it, but I also want to treat patients in that world where I have the time. And that's literally like you do these, 30-minute or full 1 hour consult. 30 minutes is like for really very specific stuff, but these full 1 hour consults, when you really want to get to a root cause. I can't get to root because yes, if somebody comes in with a big disc herniation, it takes me about 1 minute to say, do a steroid injection, you need surgery, go get laser, whatever. But if somebody comes in and says, I don't feel good, or hey, I want to lose 100 pounds, this is not a 7-minute or 10-minute or even 15-minute discussion. I need to know everything, about them. And you're doing the same stuff when it comes to, brain health and stuff. You're having these long consults with people because you can't do it otherwise. Anyway, this is great. We'll see you guys on the other side of the break. We're on AM 950 radio. This is Recharging the Human Battery. We'll see you in a minute. All right, welcome back to Recharging the Human Battery radio show. I'm your host, Dr. Stefano Sinicropi, with Mandi, Dickey, nurse practitioner, my co-host. We're on AM 950 radio. And, our time has gotten short here. I didn't get a chance to really get into the bariatric surgery and all the risks and benefits of that, and now how that all plays into lifestyle modifications, the GLP-1s, how those guys' practices have changed. It's very complicated, but in a nutshell, go and seek people that really understand a comprehensive strategy and program that are going to rebuild your muscle, make sure you're not losing that, make sure your side effects are mitigated, make sure you're the right, person for GLP-1s, you should be on it. And we'll go from there. We'll talk about this on later episodes because I'm pretty passionate about this stuff. But what I want to end up on is how we need to, talk to patients. So I had a professor where I did my training, and he was a joint surgeon, without saying names. But he would walk into the room and basically start yelling at people that they're fat. No joke. He would be like, "You're fat. You're too fat. I'm not doing this surgery. How the hell did this happen?" That is horrible. It's mortifying. I used to go behind him and have a nice conversation with the patients and, get them to stop crying and all this other stuff and say, he doesn't really mean that. He's just upset because he actually cared. He did actually care. But that was his way. Maybe if he yells at people, he does it. What I do in my thing, and again, for any of my patients listening to this or whatever, you kind of know my style. I'm very casual because we're all the same. In 1 millisecond, I could be the patient and be in the hospital bed just like you can. I always take that into things. So we're very casual. But what I say to my patients, I just kind of look at them and say, we got to talk about this weight thing. And I just disarm them and I'm smiling and I just say, we got to talk about this. And I just say, when you were a kid, when you were in 8th grade or 9th, maybe you were already overweight or whatever, but did you think that this was going to be, this is what we're doing? This is your life. You're morbidly obese. You have all these conditions. You're on all these meds. Your mobility is terrible. Like you mentioned, you have pain. And I'm just kind of smiling the whole time. And I'm just like, is this what you want out of life? Like, really, if this is what, if you can look me in the eye and say, Doc, I'm happy. This is great. I'm doing great. Then I will just say, whatever. None of them say that. Then they go on tirades about how they've struggled. They've tried this diet. They've whatever. Maybe they're trying a drug. Nothing's working. They talk to me, all this stuff. So disarming people, being very respectful. Now we're starting a very respectful partnership conversation. I'm very open. I was like, listen, we all struggle with stuff. How can I help you, get over it? So that I'll leave it there. I'll let Mandi, take the last 2 minutes here to kind of wrap things up and any parting thoughts. And obviously we have so much more to talk about on this topic.
Yeah. Yeah. I think conversations are the first place that we need to start, and having them in a respectful manner with the patient. We talk about being the CEO of your own healthcare all the time. We need to have that partnership with the patients. It's not just us as providers talking down. It has to be making that plan with the patient. And so we have to make them feel comfortable when they get in there. If the first thing you do is tell them that, oh, you're fat, that's a problem. Yes, obesity is a risk factor for a lot of issues. We can't ignore that part, but it's how we bring it up. And I was always taught in nursing school to be, again, holistic with it all. And we ask questions first. So tell me about your exercise. Tell me about your diet. What does your diet look like? Can you tell me what a typical day looks like for what you eat? Because I never want to make assumptions on what people eat. Overeating is not the only reason people can be overweight as well. Under eating, not getting enough calories can also be a problem. So that can be a whole nother show by itself too.
Yep.
But you need to get that information so that you know how to address that conversation with that. So start by getting that information. That also breaks down those walls, because then they know, oh, this person cares about me. They're asking questions. They want to know more information. So you have to get the full information so you have that full picture. You can have a good conversation, and then you know what advice to give. So that's all we can do is try to get more information, and try to give the best information we can to the patient with that educated knowledge. So that's what we do here on this show, is try to educate you guys. So until next time, thanks for joining us here on AM 950 Radio for Recharging the Human Battery.
See you next time, folks. Have a wonderful week.